Hello everybody. I'm Stephanie Shepard. I am the Partnerships Manager for the Last Prisoner Project. I'm also on the Board of Directors. The Last Prisoner Project is a national, nonpartisan, nonprofit organization dedicated to cannabis criminal justice reform. First off, I want to thank you all for taking time out of your very busy schedules to join us today for Action Needed, Expungements, Resentencing, and Immigration Relief. Before I hand the mic over to our esteemed panelists, I'd like to share a bit of my background and why I'm so passionate about the work that we do at the Last Prisoner Project. I joined the organization a little less than a year after I was released from federal prison. I was convicted of a nonviolent first-time cannabis-related offense and sentenced to 10 years. After serving 9 of those years behind bars, which was the most difficult time of my life, after I was released from prison and saw what the cannabis industry had become, I made it my mission to make sure that I do what I can so others don't continue to suffer like I did, experience loss like I did, and waste too many years of their lives like I did. That's what LPP is all about. Our legal and reentry teams provide direct services to our constituents around the country. Our policy team provides evidence-based technical assistance to stakeholders working to advance just cannabis laws. And what I mean by just cannabis laws, I'm talking about release and resentencing policies, policies that those serving long sentences for nonviolent cannabis crimes come home. I'm also talking about record clearance, which work to remove collateral consequences for people who have served their time. And I know all too well about the collateral consequences. On top of my 10-year sentence, I'm also still on 5 years of probation. I want to stress that these aren't red or blue policies. They're common sense public safety reforms supported by a wide body of evidence, and as a result, enjoy bipartisan support. And for the vast majority of Americans, they just make logical sense. When a law changes, cannabis laws have, in dozens of states over the past few years, the sentences given out under the old laws should be updated. It's the height of hypocrisy to have some Americans serving life sentences for the exact same activity that's netting some millions of dollars, and that's selling cannabis. Unfortunately, these policies don't just happen automatically. States, as well as the federal government, must be proactive in working to enact retroactive resentencing and automatic record clearance processes. And LPP is here to help lawmakers do just that. So please reach out if you need help doing that. Today, we have a distinguished group of panelists with us, including Maritza Perez Medina of the Drug Policy Alliance, Jeremiah Mosteller of Americans for Prosperity, Cynthia Roseberry of the American Civil Liberties Union, and Diane Goldstein of the Law Enforcement Action Partnership. These experts will discuss the emerging bipartisan consensus on the urgent need for comprehensive cannabis policy reform, which must include retroactive relief. Policies like the ones that LPP champion for every day. I'm excited to hear them speak, and I'm confident that we will all walk out of here motivated to take meaningful steps towards a more just and equitable cannabis policies across the country. Thank you again, and please join me in welcoming our distinguished guests.
Hi, everybody. We are on. I'm Natalie Fertig. I'm the Federal Cannabis Policy Reporter at Politico. We are here to talk about pardons, expungements, criminalization of cannabis, and I've got a really great panel here with me. We've got about half an hour, so we're gonna go fast. I'm gonna start with everyone. If you guys could just introduce yourself really quickly and tell us what your connection is to cannabis policy. We'll start at far end down here. Switch it, flip it up.
Is this thing on now? Good. Hi, I'm from the South, so you say hi back when people say hi to you. I'm Cynthia Roseberry. I'm Acting Director of the Justice Division at the National ACLU, and that is the only connection to cannabis that I'm willing to disclose here today.
Well, I'll say the ACLU is also a member of the Marijuana Justice Coalition, so there's that. Again, I'm Maritza Perez Medina. I'm the Director of the Office of Federal Affairs for the Drug Policy Alliance. As I said, I convene the Marijuana Justice Coalition. But for those of you who don't know the Drug Policy Alliance, we're a national organization that works on a number of issues. We support ending the war on drugs, ending all drug criminalization, and also and we also work to support harm reduction, so in other words, providing health services to people who use drugs.
My name's Diane Goldstein. I'm a retired lieutenant from California Policing, having spent a career from 1983 to 2004 during the height of the drug war. I'm currently the executive director of the Law Enforcement Action Partnership, and what brings me to this advocacy space in my organization is we want to put the peace back in policing and remove drugs, just like the Drug Policy Alliances. We really believe that sensible regulation of drugs will actually create police legitimacy and help us serve our communities in a way that enhances trust and communication, because we have done a miserable job of over-policing people, especially in communities of color.
Hard to follow you, Diane, every time. My name is Jeremiah Mosteller. I'm the Deputy Policy Director at Americans for Prosperity. I come to this issue because I lead our criminal justice efforts as well as our cannabis policy efforts. And we see the criminalization of substance use and of drug use as the #1 way that people are unnecessarily being pulled into a criminal justice system that is not effective. And so we want to see an end to that.
Awesome. We are going to start real quickly with Diane. If you could explain to us, there's a lot of words that we use when we're talking about drugs, when we're talking about cannabis, and I want to make sure that we're all on the same page real quick at the beginning of this conversation. So if you can start by explaining for us pardons versus expungements. How it's, Diane. Oh, sorry, Jeremiah. We're going to have Jeremiah. Sorry, everybody.
Thanks, Diane, for throwing me to the wolves there on that.
Well, no, I got the policing question. That was yours.
And since the previous panel had discussed Biden's pardons, one of the points we're talking about backstage is to make it clear to folks that a pardon doesn't mean that your criminal record goes away and that you actually get a second chance. All that is the president saying either you were unjustly convicted, you were actually innocent, or that you've been rehabilitated. But your record still exists. You are still considered to be convicted of a crime in every single both public sector and private sector database. And so we actually have hardly any expungement on the federal level. There was like one small sliver of expungement that you can get on the federal system. I know we're going to talk a little bit more about that, but just wanted to make that point clear that President Biden pardoning someone doesn't mean that they also get an expungement, and so that's why the important thing is that any legislation needs to have expungement in it.
And we have, Jeremiah, correct me if I'm wrong, but we've got a patchwork happening in the states right now, right? Some states have done pardons and some states have done expungements. Is that correct?
We do. I mean, we're seeing a rapid amount of change. I think almost every single state in the country has adopted some form of expungement expansion over the past couple years. But some states, it's automatic. Some states, it's a petition-based system. Some states, like you said, you have to get a pardon from your governor before you can then get an expungement. We would love to see all states just be automatic. That would be really great and easy and efficient. But there's some barriers in the way there, for sure.
All right. Other far end, Cynthia, could you explain for us decriminalization and how that's different in the United States from overseas, and then also how that is different from the states to the federal government?
Sure. So mostly when we think of decriminalization, we think that means legalization. And those are two very different things. To decriminalize here in the state means not to have a penalty that's more than a minor or civil penalty for that infraction. When you legalize, it means that there's no penalty for being involved, for example, with marijuana. I know that from our conversations that in other countries, to decriminalize means to legalize as we think of it. And so in some countries, you have decriminalization and support for people who have addiction issues, for example, with other drugs. So we've always looked at it through our penal system. And even decriminalizing does not take away the punishment for drug possession or distribution.
And Maritza, states decriminalizing means a different thing than the federal government decriminalizing, right? When we're talking about these laws. Can you explain that really quick for us?
Yeah, so in order for the federal government to decriminalize marijuana, we would have to remove marijuana from the Controlled Substance Act. So that means completely removing it, so not rescheduling, as President Biden has stated he supports. So we can't do Schedule 2, 3, 4, 5. We have to completely remove it from the list of controlled substances in order to finally do away with federal criminal penalties. So that's how we can decriminalize at the federal level. At the state level, it is a patchwork of laws. So at the state level, it could just mean that there's no punishment associated, or there's no enforcement mechanism for people who possess marijuana, most likely. But it's distinct from what you see at the federal level. And if the federal level did take that initiative and completely descheduled and decriminalized, it could have an impact, a huge impact on what happens at the state level for a number of reasons. But one reason is that a lot of the states actually copy what the federal government does. They copy the CSA, the Controlled Substances Act that we have. So it could have huge ramifications, because most of these arrests and convictions we know are happening at the state level. And despite the progress that we're seeing, I just want to remind people that we're talking about over 100,000 people a year that are still arrested for marijuana possession alone.
Right, and so it's kind of one of those things, in my reporting, looking through some state laws, I've seen laws where it says if you have, if you are caught possessing a Schedule 1 controlled substance, these are the things that would happen to you. So if cannabis was removed from Schedule 1, any states that were their law that way would immediately, it wouldn't like pull over into that state. That's kind of what we're saying, okay. But when we talk about bills like the CAOA or the MORE Act, those are doing more than just decriminalizing, right? Because if we remove it from the Controlled Substances Act, there's no regulation, no taxation. It's just sort of the Wild West, which, I mean, cannabis already kind of is, right? But what are the additional, let's like kind of start talking a little bit more about the legislation. What are the bills that deal with decriminalization and add expungements or pardons? And can you, Jeremiah, give us like a really quick overview of what those are? And like, are there trends that you're seeing on Capitol Hill that like all these bills do a couple of the same things?
Yeah, so there's essentially, I would put 3 buckets of proposals right now that would help with cannabis convictions. You have a couple just general expungement, kind of criminal justice reform, not cannabis-specific proposals, like the Clean Slate Act, which would allow people to get an expungement for cannabis convictions, plus other things that are moving through Congress. You also have some, what I would consider to be more incremental proposals, like the HOPE Act, which will actually provide grant money to states that want to go through this process to actually build out the systems they need to expunge state-level convictions. And then kind of in the third bucket, you have what I would consider to be comprehensive cannabis proposals, whether that be the CAOA, MORE Act, or the States Reform Act, that actually provide for federal expungement for federal convictions in addition to their decriminalization and regulatory structures. So that's just a point to put a fine point on, is expunging federal convictions is not the same thing as expunging state convictions, and bills can do both or only one. And so we need to make sure we're taking a look at that.
Can a federal bill make states expunge or pardon records?
Not based on any constitutional interpretation I've ever heard of. It can provide money to help states do that, like the HOPE Act does, because one of the things we see is that they just don't have enough money sometimes to set up the computer systems they need to actually go through the records and pull out those records.
I asked the state of Oregon last year because they did pardons, not expungements, I believe. Someone correct me if I'm wrong. Yeah, pardons. And they said that they allocated $1.2 million. And it was only about 46,000 people. I think when Illinois pardoned, they've already done over 500,000 people. So kind of it's not total apples to oranges, because every state has to hire different groups of people, but that's a lot of money.
Well, and part of the problem on the state level is still a lot of these records are in paper in state or local courthouses, so you'll have like a very rural jurisdiction where they still do everything on paper, and it's not integrated across the state level.
Right, those Oregon pardons were only done to computerized records. I remember that being part of the call there. So let's now transition and talk about the president. We can't talk about pardons and expungements right now without talking about President Biden's executive action that he took towards the end of last year, the October surprise. He pardoned a number pardoned, right? A number of people, federal level, but a whole other portion of that conversation was asking HHS to review the Controlled Substances Act and potentially reschedule or deschedule. You hit on this a little bit earlier, so I want to come back and start with you. Rescheduling versus descheduling. Can you tell us a little bit more the impact that rescheduling would have versus descheduling?
So if marijuana is rescheduled, that means if it's moved anywhere that's not Schedule 1, so Schedule 2 through 5, criminal penalties would still attach to marijuana activity, which is why we want to see descheduling, but we also want to see that coupled with administrative action and ideally a regulatory framework that centers health and justice, similar to what we see with the Cannabis Administration and Opportunity Act. Things can always be tweaked, and we're hoping to improve that bill when it's reintroduced this year. But we need to deschedule, but we have to be very thoughtful about how that's done in order to make sure that equity is at the forefront. And while the president's action was exciting, it's certainly not enough. In fact, today the Drug Policy Alliance just released a letter asking that the president support descheduling legislation in Congress, but also undertake administrative actions that can help mitigate some of the harms that people feel in their lives every day because of marijuana activity, arrests, and convictions. For example, there's things that the DOJ can do now. For example, it could provide guidance to its state prosecutors, telling them to stop prosecuting for low-level marijuana possession cases as a starter. He could direct his federal agencies to stop using marijuana convictions as a basis to deny federal benefits. These are all things that are well within his power that he doesn't need Congress to do. And we're hoping that he takes us up and does some of those actions because we're talking about people's lives. You were talking earlier about how much it costs to implement expungement programs, but there's also a real human cost and even an economic cost by keeping people locked out of improving their lives, out of jobs, out of opportunities. So if you're interested in reading that letter, Marijuana Moment wrote it up today, but also you can find it on the Drug Policy Alliance's website.
Yeah, I want to add to that. I appreciate you mentioning that, Maritza, because the human toll is really significant, especially in Black and brown communities. I want to name that. And also because there are so many collateral consequences of having a conviction. There are so many that we don't know how many there are. The truth is, when someone does serve a sentence, we don't stamp their ticket paid in full when they come out, and they might not be able to get a job or housing or access to education or some public benefits. So expungement, in addition to what we call for, which is clemency at the ACLU, are very important to try to ameliorate the tremendous harm that was caused in communities by the war on drugs.
And Natalie, I don't want to dispute anything they're saying, but I think from my perspective, I just want to be very clear that we at AFP view rescheduling as recriminalization of the current market. Because as soon as it's moved to 2, 3, 4, automatically falls into FDA control. None of the current companies are actually complying with FDA regulations, and so new criminal penalties click into place. And so we don't think that that's a solution at AFP.
And from a policing perspective, I think it's really important to understand that LEAP only supports descheduling. We will oppose every measure to reschedule because we see so much of the damage and the capital, the human capital takes a significant toll. And if we really want to talk about how we increase community health and safety, let's just all admit the war on drugs is an abject failure, has been an abject failure, just because Kevin Sabet says, hey, no one says war on drugs anymore. It's like, yes, there is still a war on drugs that's being waged, and there's a lot of rollbacks that are happening from a policing perspective, drug-induced homicide bills, there's so many different things that I think are really important to enhance community health and safety. And law enforcement does not need to be the first response to a public health issue. Let's be very clear. We need to use law enforcement resources in a way that's judicious and strategic, that only goes after truly the bad actors. And sensible regulation and legalization allows law enforcement, hopefully, to discern between the good and the bad actors. And so I'm here to support the industry that needs banking access. It's dangerous to have millions of dollars of cash floating around. we've seen robberies, we've seen crime. So if we want to enhance public safety, we need to sensibly regulate all drugs in some fashion and actually treat substance use disorder from a public health issue.
So there's got to be a little controversy on the panel. I'm going to be the one to insinuate it. I disagree that the war on drugs was a failure. It was an absolute success as it was designed, right? And we see the harm from it. In our report in 2020, we showed that if you are black, you are 3 times more likely to be arrested for possessing marijuana than if you are white, despite the fact that we use them at the same rates. And I think that is the reason that we need the harm to be addressed in addition to legalizing.
Completely agree with that.
So, continuing on the concept of policing, you have experience in law enforcement. Tell me, when you say over-policing, what do you mean by that?
So I'm just going to give clear examples. So I was a narcotics sergeant. I ran a gang unit. I had a 7-man multi-agency task force that all we did was career criminals and narcotics. And I will tell you both, when I was working gangs and as a sergeant, that we did a ton of work with federal, state, local agencies across Los Angeles County, and there was a distinct difference in policing and enforcement tactics in certain areas in comparison. Like, I would come back to my community and look at the people we served, and I know that my community would have never allowed us to do that type of policing. And I don't know why law enforcement leaders think that the only way to create safety is to go into communities of color intentionally and treat them in a disparate fashion. And systemic racism.
Thank you. Thank you.
It's systemic racism, and yes, and I call out systemic racism all the time. And so what we know is that the over-policing of communities of color in particular actually undermines police legitimacy. People don't trust us. They don't come to us. We can't solve murders, right? What is the policing role? The policing role should be to reduce crime, for the absence of crime, and to work with our communities as not just equal stakeholders, but I think that law enforcement actually has a role to play in designing community safety, but we need to ask our communities how they want to be policed, what their priorities are, you know. And so the thing that LEAP does is we are working to reduce the footprint, the harmful criminal justice interventions and footprint of policing around many issues, you know. And I'm not defending cops, let me be very clear, but part of the issue is that legislators, I believe budgets are moral documents, right? And what we do is we don't legislate more efficacious programs that actually prevent crime. Jobs, infrastructure, education, you know, after-school care, police athletic leagues, the list goes on and on. Instead, we wait until a problem is so bad, and then we send the cops, because we're the only people that answer the phone 24 hours a day, and until law enforcement stops enforcing socioeconomic issues and ending failed drug policies, we're not going to get the trust of those that we should serve, which is you guys, our constituents, our communities. So we have a shared safety model that we're working on that puts the community needs first and foremost, and law enforcement as a partner at their direction.
Does anyone want to add anything to that? Any more thoughts?
Yeah.
I know someone has
I'm
more
gonna
thoughts.
talk. I don't want us to leave here without acknowledging the fact that this panel was supposed to be about immigration relief. The pardons that President Biden granted did not include those folks who are immigrants, and we need to ensure that we're including immigrants in this fight as well. And then I just want to say that it's so refreshing as a criminal defense lawyer to hear a police officer say these words. I just want to give some props.
We've got just a couple minutes left, and I'm gonna pop my fun question that I told you guys about, which is, as a reporter, I've been covering this for 5 years now, and one of the things that I've noticed is this tension between, you know, let's legalize cannabis, let's not put any criminalization on cannabis, but let's also create pathways for people who have been criminalized for cannabis to get into the cannabis industry and make money off of it. But then time goes on and there's still people maybe making money without going through the licensing structure, and so the people that we created an avenue for to be in the industry, bear with me, I know this is a mouthful, are not making the money that was promised to them. It's like this kind of circuitous problem, right? And then we don't want to criminalize cannabis, but if you had a bar and you didn't have a license, there would be some penalty. There aren't, in most cities, I don't think you get thrown in jail for not having a license at a bar, but there are penalties, right? So how do we, you know, cannabis has matured. It's 10 years after Colorado and Washington State. We're at a point where we're starting to ask some more complex questions about how do you pair an industry with criminal justice reform and have these things live in harmony. So this is like, there's probably not clear answers on this, and that's okay, but I wanted to pose the question and see what you guys are thinking right now, because I think the question is gonna increase in this building and moving forward around the country. I'm gonna start with Jeremiah because he perked up backstage, but then open it up to everyone else as our final question.
Yeah, I mean, I'm sure we're all going to have different ideas, and I'm just going to go ahead and endorse most of what is said here, I'm sure, because they're all going to be great ideas. I think the number one thing I would say is we have to make sure state markets are done right, and we have to make sure that states avoid what I call the trifecta of failures. They cannot have high tax rates. They cannot limit the number of people that can enter the market. We should allow everyone to enter the market that wants to enter the market and not allow a few large companies to essentially dominate each state market. So we've seen that happen over and over and over again. And then last but not least, we have to make sure whatever the cost is to enter the market is low enough that anyone can enter the market. Because most of the folks with a criminal record, we know from data, their income drops by 50% if they went to prison, drops by about 20% if they just have a simple misdemeanor. They don't have the same financial resources that some of these big companies have to purchase a multi-million-dollar license. We have to make sure that those fees are low so anyone can enter the market. And if we pull down those barriers, they will be able to enter the market. There will no longer be an inability for them to enter the market.
So I'm the plus one, coming from California, so I'm really old, okay? So I saw in 1996, California pass medical marijuana, and this is how law enforcement was trained. Our city attorney came in and said, we don't care what the voters want. Marijuana is still illegal, cannabis is still illegal, and we're going to tell you that if someone says they're a patient, take their cannabis, give them a ticket, and make them bring a doctor to court. And so the issue becomes is we not only have to fix the state issues, because in California in particular, is we did not regulate medical cannabis for 20 years. And because of that, it allowed this wild, wild west to happen. And there's a reason why we haven't been able to mitigate the harms of the criminal justice system in California, was because we regulated it like plutonium, and it's legislators' fault. It wasn't Proposition 64. So smart, sensible. You have to be able to discern good actors from bad actors. You know, Senator Hickenlooper today said $3.2 billion in taxes to the legal market in Colorado since legalization. That's $3.2 billion not going to drug cartels, drug trafficking organizations, and other folks. It's coming back into legitimate uses.
Right. I only have time for one of you guys to answer this question because Justin's giving me the stink eye. Who would like to do it real
The award winner
quick?
should answer the question.
So I agree with lower barriers to entry. Obviously, we want people to be able to participate in the market, in the regulated market. And as consumers, we should want people to go to the regulated marketplace in order to ensure health and safety of the consumer. But to think that we can ever stop the illicit market is like nonsensical. It's always going to be there, not just for marijuana, but for other substances. There's always going to be an illicit market, so you cannot eliminate it. But what you can do is drive people. Think about the reason that that people are in the illicit market in the first place. It's either because they've been locked out of opportunities, in other words, because of a record or another issue, they can't get a job. Or in a lot of cases, what we see is that people sell in order to support substance use and substance use disorder. But these are all things that could be mitigated by getting rid of collateral consequences of convictions, opening up opportunities like jobs and education, supporting people, providing health services for people who use drugs. So it's, I just wanted to point that out because, yes, we all want to make sure that we're in the regulated market and the consumers can safely consume. It's very important for our health, right, that you buy it from a legitimate place. But I also just want to point out that talking about getting rid of an illicit market is what led us to the terrible situation that we're in today with, a war on drugs that's done an unprecedented number in our communities, and communities of color, low-income communities specifically. So we can't have that attitude. Instead, we got to think about ways to improve the lives of the people most impacted.
All right, thanks you guys so much. Thank you guys, everyone who spoke on this panel. Sorry we went over, but thanks everybody.